Hi, I'm Andrew Holden from Auckland, New Zealand, and looking forward to having an interesting discussion. So we wanted to present some updated data from the forward randomized control trial. This is a trial comparing balloon-expandable covered stents, specifically the GORE BVX covered stent, with non-covered balloon-expandable stents in iliac artery occlusive disease. It's fair to say that although we have some very compelling evidence to suggest covered stents have superior both angiographic and clinical outcomes, globally there's still not a full acceptance that covered stents should be the primary treatment. And so I think the question of covered stents versus uncovered stents is still globally in equipoise. And this is something that this randomized controlled trial is planning to address. Yeah, so the forward randomized controlled trial is really building on the earlier experience of the GORE VBX pivotal trial, where at 1 year, the primary patency of the device was 94.5%, with a secondary patency of 99%. So we saw outstanding 1 year patencies, and then we were able to report a longer term, that is 5 year patencies from the three largest recruiting centers. And we could see a 5 year primary patency of 89.5%. So outstanding results with the VBX, higher than has been achieved with any other balloon expandable covered stent. So armed with this experimental arm, that is the gold standard VBX, the forward trial is essentially randomizing patients with both claudication and Rutherford 5 critical ischemia who have more complex iliac artery occlusive disease. So really, we're focusing on task C and D disease in the aortoiliac segment, with lesion lengths of between 4 and 11 centimeters. These lesions can have moderate or even severe calcification, and they can be critically stenotic or occlusive disease. The patients are being randomized on a 1-to-1 basis. Otherwise, these patients are typical peripheral arterial occlusive disease patients with typical risk factors. And their primary patency endpoint will be assessed at 1 year by duplex ultrasound, but obviously there are a number of multiple secondary endpoints, including longer-term follow-up. Well, we're still very early in the recruitment of this trial, so I was able to provide an update as of the 18th of April, where 88 patients to date have been recruited, and shared the patient demographics. Essentially, they are, as you'd expect for a peripheral arterial occlusive disease patient group, with a significant incidence of dyslipidemia and diabetes. There was almost at this early stage 1-to-1 ratio between men and women, which is an interesting finding. Often we see a higher prevalence of iliac artery disease in male patients, so that will be an interesting trend to watch over time. But obviously unable at this stage to show any procedural outcome or follow-up data. So, in conclusion, we've had obviously some outstanding clinical results with the GORE VBX covered stent. I haven't previously mentioned that we've also shown it's a cost-effective treatment. We've published that if you look at the total procedural costs, including freedom from reintervention, then VBX is highly cost-effective compared to other strategies. And despite a very effective and cost-effective treatment, we still are in a situation globally where there is a reluctance to use balloon-expandable covered stents as primary treatment. And I do hope that this forward randomized controlled trial will provide more evidence to support that in particularly complex aortoiliac disease, we should be using VBX to manage these problems.